video, we're going to discuss about patient-related terms, starting with Social Security Administration, SSA. Now, the SSA is something similar to our UIDAI. It is an independent agency of the US federal government that administers Social Security. Now, what is Social Security? A social insurance program consisting of retirement, disability, and survivor benefits. This is something similar to our PF and pension fund. Now the next term is insured subscriber or policyholder. A person or entity who buys an insurance policy is called a subscriber. Now, this subscriber may have his family members listed under his policy, like the subscriber's spouse and the child. Now, the spouse and the child are considered as covered members or dependents. The term spouse can be used to describe a person as a husband or wife. It can be used in either way. Now the next term is guarantor. The party paying for an insurance plan who is not the patient. In the above example, the father will be the guarantor for the child since he is the one paying for the child's insurance plan. Now the next one is benefit. The amount payable by the insurance company to a plan member or policyholder towards the medical cost coverage. Now, the main purpose of taking an insurance policy is for the insurance company to pay for your hospital and physician bills. These payments are nothing but the benefits. Now the next term is enrollment date. The date on which the subscriber enrolls with the insurance company by paying the first premium. This is the date on which the insurance agent collects the first premium payment in the form of check or cash. Now, once the payment reaches the insurance company, they will update the subscriber details in a database and then generate a policy number for the subscriber. This process may take a week to 10 days time. Once the policy number is generated, insurance coverage becomes effective. That means benefits will be activated from that day, also known as effective date or start date. Now the next one is termination date. It is the date on which the patient's insurance policy expires or terminates, also known as expiration date. Now the next one is premium. A monthly charge you pay to the insurance to keep your coverage active. The insured or policyholder pays premium to the insurance company, and in return, the insurance company will provide benefits in the form of payments. If you miss paying the premium in a particular month, your benefits will become inactive during that time period, even though the policy will still be active. Now, In order to understand this in a better way, let us take the example of a set-top box. I'm sure that everyone has a TV at home. Now, in order for us to watch programs on the TV, we need to pay subscription fee or top up the set-top box. If we don't top up the set-top box, then even though we have the equipment with us, we will not be able to see programs on the TV. The same thing applies here. The set-top box is the policy, the subscription fee is nothing but your premium, and the programs are the benefits. The next one is date of service or encounter. The date on which the patient received medical service or treatment from the provider, also known as DOS. Now, the face-to-face interaction with the provider is termed as encounter. Now the next one is drug formulary, a list of prescription medications covered by the patient's insurance policy. As discussed earlier, insurance policies in US provide medical coverage as well as prescription drug coverage. Now, this depends upon the type of plan the patient chooses. Prescription coverage is considered as an add-on to the medical coverage, and patient has to pay separate premium for it. Now the next term is self-pay. Whenever a patient doesn't have insurance coverage, or whenever patients undergo a service or treatment which is not covered under their policy, then they must pay for the service out of their own pocket. These patients are also considered as self-pay patient. Now, if the patient wants to get an ultrasound test done, but if it is not covered under her insurance policy, then the patient has to pay for the service as a self-pay. Now the next one is pre-existing condition. A health problem that has been diagnosed or for which the policyholder may have been already treated for before buying a health insurance policy. A very common example is diabetes. Waiting period. The period of time that an employer makes a new employee wait before he or she becomes eligible for coverage under the company's health plan. Now, let us assume an employee is changing his job. Now, till the time the employee was working with the old employer, he would have insurance coverage through Insurance One. Now, since the insurance policy is provided by the employer, it will terminate on the last working day of the employee. When the employee joins the new employer, he will not be provided with an insurance policy on the day he joins the new organization. The HR department needs to finish few formalities like background verification, etc. before they can forward the employee details to Insurance 2. And it may take a few more days for the insurance company to generate a policy number for the patient. So altogether, the employee has to wait at least few weeks before he can become eligible for coverage under Insurance 2. And the other scenario is the period of time beginning with a policy's effective date during which a health plan may not pay benefits for certain pre-existing conditions. Now let us take the example of a typical diabetes patient. Whenever the provider bills any claim with a diabetic related diagnosis, insurance company is going to deny those claims till 6 months from the policy beginning date, but will start to cover even diabetic related services after 6 months. Now the next one is medical necessity. Any healthcare service provided to the patient must be reasonable and necessary in terms of diagnosis or treating the medical condition of the patient. This does not include cosmetic procedures like hair transplant. Now the next one is waiver of liability. This document is signed by the patient stating that they will be responsible for the cost of services that may not be covered by their insurance policy. Now the doctor's office makes patients sign the waiver of liability form when they are planning to perform a procedure which may not be covered under the patient's policy. Now, in the case of Medicare patients, doctor's office has to make them sign the ABN, which is Advanced Beneficiary Notice, instead of waiver of liability. Since Medicare is a federal insurance, it has a separate document which can be downloaded from the CMS website. Now the next one is assignment of benefits. This is a written authorization or declaration given by the patient stating that the benefits, which means payments paid by the insurance, could be directly sent to the provider. If AOB is not signed, the payment by default would be sent to the patient. Here the insured or subscriber is paying premium to the insurance company and the insurance company is providing benefits to the patient. Now the patient is made to sign the AOB by the insurance company so that they can transfer the patient benefits directly to the doctor in the form of reimbursement. And the doctor's office makes the patient sign the AOB so that they can seek payment directly from the patient's insurance company. So basically the patient is assigning his benefits to the provider. Now the last one is release of information, also known as ROI. This is a written authorization or declaration given by the patient stating that the patient medical information could be released to the insurance by the provider if necessary for the claim to be processed and paid. The patient is made to sign this document so that the doctor's office can share patient-related documents like X-rays and blood tests with other entities like insurance company in the process of requesting authorization. Thank you.